Adverse childhood experiences can range from a child dealing with divorce to abuse situations to bullying. COVID-19 has introduced new barriers to dealing with ACEs, as they are sometimes called. Dr. Chad Rodgers, a pediatrician and medical director at the Arkansas Foundation for Medical Care, and I discussed. We're going to talk about adverse childhood experiences, commonly referred to as ACEs, although people will probably hear more the phrase adverse childhood experiences. What are they?
Yeah, so adverse childhood experiences are sort of a collection of some traumatic events that may occur during someone's childhood. They're very common. Of course, we all have known some sort of trauma in our life or something that was sort of stressful. But these are traumatic events that can have long-term effects, not just on your mental health, but on your physical health as well. So there's about a handful of 10 that we kind of look at, but there's a lot more traumatic events beyond that. A lot of these were defined by the CDC. And kind of fall in the what you traditionally think about as trauma, being child abuse or neglect, but also sort of a handful of household dysfunction, such as mental illness of a parent, maybe having a parent that's incarcerated, so you have parental separation, or through divorce, or seeing your mother treated violently.
Why is this just kind of becoming more of a field of study? I mean, when we grew up, divorce was fairly common.
Right.
You would certainly be aware of domestic or child abuse on occasions. It wasn't widespreadly known, but
Yeah.
Why is it just now becoming, I guess, a little bit more of an area of stricter focus?
Yeah, I think anybody who's worked with children, I'm pediatrics, but also talking with educators, it's kind of things that we've always kind of known intuitively. We know that traumatic events have had an impact on families and have an impact on children's lives. But now there's just this growing body of evidence and science, and people sort of wonder, so the more ACEs you have, the more likely you're to struggle with chronic medical problems. Now we know, because of the process of inflammation and stress and your body's reaction to stress, that does have long-term impacts. So I think it's really kind of beginning to have the language to talk about it, but also the research that backs it up.
Resilience is key, particularly for the kids,
Correct.
as they go through these adverse childhood experiences, these ACEs. How does resilience form?
Yeah. So I think we often focus a lot on the trauma and not enough on the resilience. So I'm glad you brought that up, because that's so important to everybody's life. That they have somebody in their life who's sort of a consistent and trusted source to help them learn how to deal with stress, because stress is just part of life, unfortunately. So resilience is a very important factor. We know that the most important factor in protecting people against trauma is if they have that supportive, nurturing, consistent relationship in their life, whether that's a parent, a grandparent, a youth pastor, maybe an uncle or an aunt. But those relationships are really important to kind of protecting people from the long-term impacts of the stress.
How has the pandemic affected adverse childhood experiences?
I think the pandemic has become its own adverse childhood experience. I think a lot of people are experiencing a lot of stress related, not just to, having family members maybe getting sick, but just the impact of quarantine. A lot of the traditional factors that kind of foster resilience are not in place. Schools have been out, people have been separated from loved ones. So it's been a really challenging time. So, I've been telling people, if you're experiencing stress and you're having some anxiety, it's probably a normal reaction to what's going on, but it's definitely had a huge impact.
What are the policy calls to action here in terms of adverse childhood experiences? What needs to be done at the state and the federal level?
Right. Well, so I think all those things that kind of support and protect. So again, we talked a couple weeks ago about school. School is a very protective place, sometimes the safest place a child will be, but in the midst of a quarantine, we want to keep people healthy. But sort of supporting things that contribute to sort of the systemic problem: poverty, food insecurity, housing. Those are all important policies that kind of go into place to make sure that people have what they need in order to be safe.